Hello, I am Bharvi Kapoor, a student from Pathways Noida, grade 5E. And today I have with me Dr. DK Gupta, MD and founder of Felix Hospital. Hello, Dr. DK. How are you?
Hello, Bharvi. Bharvi, I am fine. Thank you so much.
Okay. So, are you willing to answer few questions to our viewers?
Yes, I am really excited to do that.
Okay, let's just get started with the first question. So, what exactly is the coronavirus?
Yes, coronavirus is a family of several hundreds viruses. It has 3 to 400 viruses. And one of these viruses is known as COVID-19 viruses because that was a strain isolated last year in the China after this during this COVID pandemic. Really, this is mRNA viruses that cause infection in the upper respiratory tract infection and can go trickle down to the lower respiratory tract and can cause pneumonia and ARDS also.
Okay, that was a wonderful answer for the question. So let's just go on to the next question. So, what symptoms are there for the coronavirus?
Okay, so this is like just like flu symptom, like patient will have cough, cold, fever, throat pain, body ache, malaise, chills with rigor, sometimes without rigor. Sometimes few patient complaints of loss of taste, loss of smell, and also sometimes rarely it can produce other symptoms like diarrhea, vomiting, pain abdomen also.
That was really interesting. Thank you, Dr. DK, for that answer. So, let's just go on to the next question. What exactly happens when corona enters in the body?
Okay, so corona can enter through 3 or 4 ports of our body, like it can go through eyes, also nose or mouth also. That's why we ask some people to do not touch these parts with our fingers because these are the entry points or portals from where corona can enter our body. It goes inside the nasopharynx, that is upper respiratory tract part, and where it binds with the respiratory epithelium. There are few receptors named as ACE receptor. The spikes proteins of the coronavirus, they bind with these ACE receptors and they go inside the cells of this respiratory epithelium where it get multiplied, means it get replicated in many copies, thousands and lakhs of copies. And after that, it goes to in a lower part of the lung, and where it causes pneumonitis, means pneumonia is a consolidation of the lungs. Basically, it damages the alveoli where oxygen transfusion happens, basically transfer of oxygen and carbon dioxide. Later on, it can cause ARDS, that is acute respiratory distress syndrome, means severe lung disease that result in dyspnea, means shortness of breath, chest discomfort or chest pain. And later on, at the end of disease, it can lead to multi-organ dysfunction, means involvement of other organs like kidney, liver, heart, and brain.
That was very interesting to figure out. So let's just go on the second last question. What is the prediction for the vaccine coming out?
This is the $1 million question, and I think around 12 vaccine has been approved for local or emergency use in different part of world. But we are waiting in India right now, and there are two consent for this vaccine in India. Like one is AstraZeneca, with he has produced vaccine with collaboration with the Serum Institute of India and Oxford University, and they have already made 50 million doses right now in India, and they are just waiting for approval of DGCI, Drug Controller of India. They are waiting for just approval. Most probably in this week only we will get approval from DGCI, and next year will be healthy year for every Indian, and we will start inoculation of vaccine from next year in month of January onwards. And government has prepared for this inoculation program. It will include like storage, transport, distribution, and inoculation. And we have prepared, and government has prepared for all these. Like they have prepared manpower, they have given trainings and logistics, and other requirement has already been done.
That's spectacular news to hear. So, the last question would be, how can we take precaution to not catch this flu going around?
Yes, that is very important, because if vaccines comes, still we will be vulnerable to get infection, because we require at least 2 doses of vaccine 1 month apart to get immunity. And after 2 doses, at least 4 weeks are needed to get full antibodies in our body. Means for fully immunization, we need at least 3 months, 0 dose, 1 dose, and 1 month for development of the antibodies. It means if somebody get a vaccine on 1st of January, till 31st of January, he will not be immune. After 1st April, he will be fully immune or partially immune, depending upon the efficacy of the vaccine. That we know that most of the vaccines are having efficacy of between 70 to 95%. It means they are not giving 100% protection. Therefore, we have to wait till herd immunity is there in our society. And herd immunity only happens when there are around 70 to 80% people are either infected or immunized through vaccination. Therefore, we have to take these precautions for at least next 6 months, like frequent hand washing, not touching mouth, nose, and eyes, keeping social distance around 2 to 3 meters, wearing masks, and avoiding crowded places, so that we should not be infected in next 6 months.
Okay, that's really nice to hear. And sadly, this is the end of the interview. And a big thank you to Dr. D.K. Gupta for allowing me to do this interview. Big thank you, Dr. D.K.
Thank you so much. I really enjoyed conversation with you and looking forward to see you again. All the best. Thank you. Take care.
Bye.